Today I will be talking to you about the cardiovascular system. To start, we will talk about the basic anatomy of the heart. The basic flow of blood of the heart starts when deoxygenated blood enters through the superior vena cava or the inferior vena cava, then enters into the right atrium as it passes through the right AV valve or the tricuspid valve. It then goes down into the right ventricle. After it has entered into the right ventricle, it goes up into the pulmonary artery and into the lungs. Blood is pumped into the lungs so it can oxygenate the blood. After the blood has been oxygenated, it is then pumped back into the left side of the heart through the pulmonary veins. Through the pulmonary veins, it enters the left atrium, passing through the left AV valve or the mitral valve. Then, after it passes through the valve, it is then entered into the left ventricle. After entering the left ventricle, it is then pumped up through the aorta, which these three channels here pump it to the superior part of the body, and what you can't see on the backside, they call it the descending aorta, and that is pumped to your lower half of the body. So a basic recap of the blood is the right side of the heart pumps the blood to the lungs and the circulatory part of the body. The blood vessels are basically pipelines for carrying blood to and from the tissues. The left side pumps it to the body as the right side pumps it into the lungs. Now we're going to talk about the AV node and the SA node. As you can see here, the sinoatrial node, or the SA node, and the atrioventricular node, or the AV node. SA node, AV node. The main role of the AV node and the SA node are to initiate action potential so it can pass through the heart and cause contraction. Next, we're going to talk about cardiac output. The stroke volume is the amount of blood ejected out of each ventricle upon each cardiac contraction. Also, heart rate is calculating how many times your heart beats per minute. This is needed to figure out an individual's cardiac output. To determine cardiac output, you can use the simple equation of CO equals heart rate times the stroke volume. A simple definition for cardiac output is the amount of blood ejected by the heart every minute. Next, we're going to talk about a few factors that can affect your heart rate. There are a few factors, and they are age, gender, your body composition, the type of food you put in your body, the posture, and the emotions you go through on a daily basis.